Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today's Friday, June 5th, and this is my daily briefing. Our numbers haven't changed, so we've still had a total of 42 cases to date in Missoula. 40 of those were identified by testing and 2 were epi-linked. We've had 41 recoveries and 1 death, and we have no active cases in isolation currently. The state of Montana has had a total of 541 cases, including 2 new cases today in Lewis and Clark County. Today we also learned about 1 more COVID death in our state in Bighorn County, meaning that 1 more life has been lost to COVID-19 or from complications of COVID-19. Our deepest condolences go out to those affected by this loss, which is more than just a number, but rather a human being with family, friends, and loved ones, and someone that had a place and purpose in their community. This loss reminds us that we need to continue practicing safe behaviors and respecting local guidance across the state and anywhere that we might travel at this time. Montana is home to so many beautiful and wonderful places where a diversity of individuals and communities reside. And to that end, about 7% of our state's population includes American Indians and Alaskan Natives, representing 7 reservations, as well as the Little Shell Chippewa tribe, which is our country's most recently federally recognized tribal entity. 7% of our population amounts to about 70,000 human beings, those which history, public health, and epidemiology indicate disproportionately experience health disparities, including comorbidities like diabetes, uncontrolled asthma, and heart disease that could increase a person's risk of acquiring COVID-19. And if COVID-19 is acquired, it is likely going to exacerbate those pre-existing health conditions while creating significant new health issues. Tribal entities are self-governing bodies. Tribal entities across Montana have elected to maintain stricter protective measures, promoting the health and safety of their local tribal members. Representatives of the Blackfeet, Crow, Northern Cheyenne, Flathead, Fort Belknap, and Rocky Boy reservations continue having a stay-at-home order or a shelter-in-place order. Examples of other protective measures include the Blackfeet Nation closing access at the East Glacier entrance at Glacier National Park and the Salish and Kootenai suspension of non-tribal recreation on Flathead land. These protective measures are important to maintaining the health and safety of our American Indian and Alaskan Native residents, and they really must be respected, particularly as we continue seeing cases increase in counties that are either home to or neighbors of tribal lands like Bighorn and Yellowstone counties. Tribes have their own identities, languages, histories, and cultures that must continue being protected, even more so during this pandemic. Across many tribes, elders hold language, history, and cultural context within themselves. The elders then share this information, model cultural traditions, and teach really important lessons to younger tribal members, ensuring that the information gets carried from one generation to the next. That information and knowledge is living and living within people. Sharon Stewart Paraguay, a member of the Crow tribe, shared with Montana Free Press today that, and I'm going to quote her, "When an elder dies, there's a whole history, a whole line of information that we lose. It's like the library burning down," end quote. This is why so many tribes are rightly actively maintaining stricter health and safety orders across their lands and in their communities. Protecting those people better protects their history and better ensures that their cultural knowledge will continue to live and grow and be able to be passed on to the next generations. Governor Bullock and us here at the Missoula City County Health Department acknowledge that tribal leadership and governance and respect their authority to help keep protective measures into place. This not only promotes the health and safety of individuals, but helps to ensure that their history and traditions remain alive. Some tribes have initiated routine, comprehensive testing, like Blackfeet Nation, which is on the way to testing everyone on the reservation at a drive-through clinic. All tribes continue to be supported by state and local agencies who are currently planning how best to implement a systematic testing of priority groups, including American Indians and Alaskan Natives that call Montana home. We ask that you continue practicing safe behaviors, learn about local health orders, and respect local guidance. It could not only protect you and others, but also protect local histories and cultural traditions. So the last thing I'd like to talk about is I'd like to let you know that I'm taking a mandatory respite next week. Ken Parks from the county will be the incident commander. He has a long history of working within the incident command structure and has already been part of our integrated city-county response effort since late February and early March. You can expect to continue receiving daily briefings from us, and the media can expect to continue to have a scheduled daily access to someone within our ICS structure. Next week, you'll have the chance to meet some of the other staff that have been connected to our response, as well as learn about the many donors and volunteers that have supported and continue to support our response efforts. So thank you to everyone for everything that you're doing to stay well and be safe out there and help protect our community from the spread of COVID-19. And that's it for my daily briefing. You can always subscribe to me on YouTube. Just click that little notification bell so that you get notified when additional videos are uploaded. That's under my name, Cindy Farr, CINDYFARR. That is where next week's videos will also be uploaded in my absence. You can follow us on Facebook for great information. That's under our Missoula City County Health Department's Facebook page. And you can check out our website at missoula.co/cvirus for great information and guidance. You can call 258-INFO if you'd like to schedule a test for COVID-19, or if you just have general questions or need more information about resources that might be available to you. And again, that's 258-INFO or 406-258-4636. All right, everybody, stay healthy, and I will talk to you in about a week and a half when I return.